this podcast, you'll find interviews with high-performing, successful individuals in life sciences. On a weekly basis, we cover their proven methods, principles, strategies, and mindsets to implement new technologies that scale to meet the needs of people in our world.
Today, I'd like to welcome to the podcast Dr. Frazier. She's a native of New Orleans and the co-founder, president, and CEO of Obtala Sciences. She's an experienced adult stem cell researcher and biotech business professional with 15 years of experience in biomedical sciences and management. She holds bachelor's degrees in physics and biomedical engineering, an MBA, and a PhD in biomedical sciences. Dr. Frazier completed her postdoctoral work at Pennington Biomedical Research Center and the Tulane Center for Stem Cell Research and Regenerative Medicine. She has trained and collaborated with national and international key opinion leaders and held academic chair appointments prior to her leadership role at Obtala. Dr. Frazier has received numerous awards, including Gambit's 40 Under 40, Dillard University's 40 Under 40, the ADA Lovelace Award for Women in Tech, and the Women of Distinction Award. Dr. Frazier is an advisory board member for Reopening New Orleans during the COVID-19 pandemic recovery and is co-chairperson for the Public Health Working Group for the city. Dr. Frazier is also a wife and mother of 3 boys. She's dedicated to growing her firm in the city of New Orleans and lifting up the next generation of local talent. And so today to the podcast, I'd like to welcome Frazier Frazier. Welcome, Trivia.
Thank you, Don.
So first of all, I'd like to start with a little bit about what started your career down this path in life sciences.
Yeah, I ended up in this career by accident, essentially. I've always had a love for and a passion for what I would call all things related to STEM. So I started out, and I do say that my first love is physics. Don't let my husband hear that. My first love is physics, and I fell in love with physics because I also loved mathematics. And there was an aha moment by which I realized that, whoa, physics uses a lot of math. And that was in high school. And my high school teacher, she explained all of the concepts so clearly. She broke down all of the concepts in such a way that it did not seem difficult, and not entering a field with any preconceived notions made it a bit easier to just choose what I liked. And that started what has been a whirlwind of personal and professional development, starting out with physics and then biomedical engineering. And when I learned of tissue engineering and its capabilities and the potential impact on society, that led me to this pathway of a career in life sciences.
That's excellent. So you're currently a co-founder of Obtala Sciences. Tell me a little bit about what is the company and what is it that they do?
Yes. So Obtala Sciences is a biotechnology toolkit firm. We market ourselves as the picks and shovels for researchers to mine for new cures. And what I mean by that is essentially taking us back to the California gold rush at a time during which there were, of course, many people digging, looking for gold. And Strauss recognized at the time that there were all these people looking for gold, these miners. What are the chances of striking gold? However, every single miner needed the clothes, needed the picks, the shovels, reliable tools. And that became a name that is still around today. It's still recognized today. And so what we're doing is we are not developing therapies, but we are enabling researchers to develop the next therapies for diseases that impact the fields of obesity, diabetes more specifically, and regenerative medicine. So that is our niche. That is our core set of expertise, expert areas. But we're impacting also the fields of cancer and many of the other metabolic disorders that impact individuals that suffer from obesity.
And any of our listeners would know as well that I love a story. My next question is really, what does Obtala stand for?
Yes, yes. So I'll say this as well. I am Nigerian, and being of West African origin myself, I have a true love and appreciation for a number of the deities, the Orisha, as they're called, and the religious aspects of the culture, which is very rich and diverse in that area. And so Obtala is one of the West African deities. The story goes that Obtala used naturally occurring materials, clay and mud, to form the human body. And what we use are naturally occurring biological materials derived from humans to essentially mimic tissues of the human body. So we thought it was fitting to not only take a different approach by naming the company after a West African deity, as we are promoting diversity in research, but also to more specifically hone in on that aspect of mimicking tissue, of building the body.
Okay. And I also heard that you sell fat on a chip. What is that used for?
Yes. It's not to eat.
Let's hope not. Yes.
It wouldn't even sound appealing. Let's eat some fat on the chip.
I don't know. Super Bowl party, there are plenty of fattening things that all of us get involved in. So yes, tell me about fat on the chip.
Yes, we sell what's called fat on a chip. Essentially, there is an organ on chip industry that is booming, burgeoning. It is a rapidly growing industry that is essentially an attempt for mankind to address some of the issues that are around our heavy dependence on mice and really animals, and conducting animal studies and using that as a mechanism for us to make informed decisions about how the human body responds to therapies. We've seen a number of the shortcomings that arise out of that, as the attrition rate is essentially only one drug out of 10 makes it successfully down the pipeline with respect to the drug therapies, the clinical trial, essentially studies. And so within this field, what researchers are doing is we are taking cells and biological materials, mixing them and seeding them on different platforms, whether that is a substrate that applies a flow over it, or it is a substrate that is a static culture, and essentially establishing three-dimensional constructs. These are in vitro systems that are designed to mimic the tissues inside of the body, the cells, and how they behave inside the body. And these on-a-chip systems are called on-a-chip systems because they're either on microfluidic chips, which again are cells, biomaterials, and we apply a flow across those cells or within that sort of environment to recapitulate the forces that cells would feel inside the body. Or they are established within perfusion bioreactors, which are larger scale, again, constructs. And what we have is a mechanism to establish an adipose depot or a fat depot. And that, since it can be established on or within a microfluidic chip, we call it our fat on a chip. It can also be established in multiple substrates. I refer to the perfusion bioreactors in static, so 96 multi-well plates. Any substrate, because of the type of products that we manufacture, they are amenable to multiple, substrates, but we focus on the on-chip. So we call it fat on a chip.
Where do you get the fat cells from?
Yeah, we get the fat cells from what's routinely discarded medical waste. So liposuction from abdominoplasty, people enhance themselves, but also orthopedic procedures. So total knee replacements, total hip replacements, those types of things. Millions of samples are discarded each year. And this brings the opportunity for us to isolate stem cells from that adult tissue and repurpose it, essentially.
Okay. And are there specific uses for things like this, or is it limited in any way? Just curious in terms of the background and use.
Yes. So for any of the in vitro systems that are being established, the goal is to make multiple tissue systems, organ systems, and then connect them in what's going to be called a human on a chip in terms of the ultimate goal for all of us. But the limitation is there as an in vitro system. It does not have all of the components that you would, of course, see within a fully functioning macroorganism, a human. And so we keep that in mind with all of the studies that we conduct, that we design, and address certain outcomes accordingly, with that caveat, which applies across the industry. Our fat on a chip kits, which we sell essentially to researchers and allow them to basically take a box of products and assemble them together using our instructions. And then voila, you have a fat depot. It allows researchers to then test their compounds, these compounds sometimes for repurposing applications. So a compound that has been retracted from the market because it's not working accurately, or even for discovery or efficacy-based studies. These constructs allow more insight into what the tissue is going to produce as an output, as a response to therapeutics that are being developed. And so in many cases, the question is, if there's a compound that's being developed that is specifically targeting a certain cell type, such as the endothelial cell, based on a vascular response, then the question is, how do the endothelial cells respond after so many hours of exposure to this compound? That's one example. Another example is looking at the outputs from the fat itself, which we call adipokines or adipose cytokines. They can be a reflection of both pro-inflammatory or anti-inflammatory responses, and each of those can be linked to specific cell types. So it can give a wealth of information in response to compounds that are being developed to target certain diseases.
Excellent. And so I also heard that you're working on something around burn healing as well. Is that correct? So that's a portion of your science as well?
Yes, we are. One of the things that we're working on, which is included in our fat on a chip, is a human-based hydrogel. It's a simple concept in that right now we are very heavily reliant on not only mice in the mouse trials, the animal trials, but also a mouse tumor-derived gel. It's a hydrogel that we call Matrigel. That is used in many of the three-dimensional cell cultures studies, and it's used in the preclinical testing process. And so our human-derived alternative, it enables essentially the same thing. It's three-dimensional culture of human cells, except it's superior because it's obviously a fully human-based system. We use that hydrogel for the research applications in the organ-on-chip application. So it's mainly for drug discovery, preclinical testing. Another application of this hydrogel, because it is a human blood-derived gel, is wound healing. And so essentially what we have discovered is that this gel not only supports cell growth, and when we say cell growth, we tested it in the context of mesenchymal stromal stem cells and other heterogeneous populations that are derived from mature tissue, but also endothelial cells. So I mentioned endothelial cells earlier. It supports a growth of new blood vessels, so angiogenesis as well as vasculogenesis. And because of that, we are pursuing the commercial application of these gels for military field applications, more specifically wound healing. And battlefield applications, of course, are going to be one of those indications. But a primary indication that we are pursuing is for usage in pressure injuries, or formerly known as pressure ulcers, in individuals that essentially have a wound that may affect either their skin or the subdermal layers or even down to the bone. And of course, it's very painful. The process for clearing it and helping to regenerate that tissue is a labor-intensive process. And the gels, the hydrogels, can be used to mitigate not only the impacts from the pressure on the site, the wound itself that has impacted the tissue and helping to revascularize that tissue, but it can also reduce the burden on caregivers with respect to needing to go in and debride the wound constantly. So it's a very interesting gel with multiple applications.
So for pressure wounds, so would that also include, so I know people that are diabetic, right? They occasionally get wounds. Would that include these types of wounds as well?
Yes, okay. Absolutely. Absolutely.
Very nice. And so where is Obtala located?
Yes, Obtala is located we are in New Orleans on the University of New Orleans campus in what's called the Advanced Materials Research Institute, or AMRI. AMRI House is a home to a number of other biotechnology companies, but we are occupying about 2,000 square feet within the facility, and we have room to double and actually quadruple our space here. So it's a great environment. We are right in the middle of the engineering and physics departments. And so there's opportunity for us to collaborate with a number of fantastic researchers here, as well as work with some of the equipment here on campus.
So I heard you mention physics again, so you can go hang out with the physics guys anytime that you want to and come back to life sciences anytime you want to. Great.
Yes, of course.
So, just recently, I know that a hurricane just came near you. And like most of us working during the COVID pandemic, hasn't been easy. Did the hurricane at all add to the complexity or change the way that you work? And how are things going with working during COVID for you and the folks at Obtala?
Yeah, there are a number of ways by which we make special considerations for events like what we have had. This has been a very active hurricane season for us. There were 3 hurricanes that really did give us a scare in terms of the trajectory versus where they actually did end up hitting landfall. Our neighbors to the west of New Orleans in Louisiana are in our thoughts and prayers. But we did have to give special considerations for studies that we have ongoing. For example, we had to temporarily make sure that they were at a stage that we could halt those experiments. If they required us, for example, seeding new cells, taking cells out of liquid nitrogen and putting them into culture, we delayed those studies because we wanted to ensure that, 1, our staff are safe, everyone is safe, and 2, that the equipment and everything was secured. So we had to make those preparations. And again, we were very lucky, but it is something that does come to mind. Thinking of Hurricane Katrina and its impact at that time, I was just an undergraduate student when Hurricane Katrina hit, but I do remember, of course, how impactful that was.
Yeah. Well, you're certainly on a lot of our minds whenever we start to see a hurricane come into land anywhere near New Orleans. So thank you for that explanation. So I like to ask the same 3 questions of every guest. And we're at that point in this episode where I'd like to just ask you, what inspires you?
Yes, I can't believe we're here already. It's been a great conversation. What inspires me is the interactions that I have with students, that I have with other individuals, I would say, that have excitement. They have that same energy that I saw pretty much, or that I felt when I was at their stage of my academic career and training. That is so inspiring. It's so exciting. And it helps, for us to push through those tough moments when we think about people who have such a strong desire, who have a love and a true passion for what they're doing, similarly to my own feelings. So.
Very good. And what concerns you?
The state of our country concerns me. We are a very polarized nation right now. And if we take COVID-19 and if we take any virus or any deadly, naturally occurring situation that we face collectively as humans occupying Earth, it's us against that particular entity or disease or virus. That virus has no preference for our age, ethnicity, any of that, gender. And the concern that I have is division creates disaster. And we need to be more collectively engaged in working towards survival and enjoying our environment, our natural environment together.
Yeah, I agree. And it's interesting because I think now you're the third guest that more or less has talked about the division that we have. I know that Jeff Andrews specifically talked about just not respecting science and not trusting what science was telling us. That was one. And then Dory Clark also had said very specifically that this worry of unrest doesn't help us overall as human beings. And so your answer, I feel, even rounds those out even more. So thank you for your response. The last one is, what excites you?
Yes, a new day. The thought of a new day, which brings a new start and the opportunity to embark on a new level or a new degree of exploration and of accomplishment, whatever that may be. That may just be getting through the day sometimes. A new day brings sunshine and the opportunity to not let what happened the previous day or in the past or the previous year stop us from working towards our goals.
Very good. And a new day brings new science and hopefully more fat on the chip. Thank you for that. So Trivia Frazier, thank you so much for being a guest on the show. I greatly appreciate your time and greatly appreciate you taking time with me to walk through what it is that you and your team are working on. Thank you so much for being a guest.
No problem. Thank you very much. I truly enjoyed our conversation, and I look forward to listening to your other conversations as they've all been wonderful. So thank you again for your time and the opportunity.
Thanks so much. Thank you for listening to Life Science Success. For complete details about this podcast, including show notes, how to get in touch with guests, and more episodes, please visit www.lifesciencesuccess.com. If there's someone you'd like for us to invite to the show as a guest, please let me know by sending me a message at the podcast website. Please click subscribe on your favorite podcast app, share the podcast, or tell a friend about it. And last but not least, rate the podcast. Thank you again.